Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with bilateral, so when we say bilateral we mean both ears, really deeply impacted dead skin plugs. Now this patient has to have this removed every 2 or 3 years, and an inexperienced version of myself many years ago would possibly have assumed that this patient actually used cotton buds or Q-tips and impacted this in because it's so deep and impacted. But over the years with experience, you kind of realise that actually this is not the case. Instead, the skin that lines the ear canal, for anyone that hasn't watched my videos before, we have a very thin layer of skin that coats and lines the ear canal and the outer membrane of the eardrum. And as that skin dies and sheds, it moves sideways, so it moves laterally towards the entrance of the ear, almost like a conveyor belt. And then you get another layer of skin, and that sheds and dies, and that then also moves out of the ear naturally in a sideways motion, like a conveyor belt. And that sideways motion, that conveyor belt of dead skin that's continuously shedding and migrating out of the ear, it also takes out with it any wax that's sitting on the surface of the skin. However, with some patients, what happens is that they lose the ability for the skin to migrate, or there's an abnormality within the ear canal itself which prevents the skin from migrating any further. And you'll see when I remove this skin plug and also the one in the other ear, the left ear, that the patient has got quite a narrowing deep in the ear. So it's very plausible that this skin is trying to migrate, but it's getting trapped. So it's very adhesive to skin plugs. So dead skin, it's almost like double-sided sticky tape. And it really adheres itself to the canal wall. So just put some oil in there. And you can see all that white, the white coating of this plug. That's a fresher layer of skin. And that skin, if this plug remained in the ear for another 2 or 3 years, that white layer of skin will be more in the centre, and it will have oxidised and it will have turned more brown, darker in colour. And you can see how I just removed that. And here's the patient's ear. You can see there's a narrowing there near the eardrum. We call that the isthmus, and it is quite a pronounced narrowing. Nonetheless, we managed to remove that, and the ear canal's nice and healthy. The eardrum was intact and healthy too. So this is the patient's left ear, and I immediately put some olive oil drops in straight away. And I'm actually suctioning whilst the drops is in the ear. You would have seen a couple of times that it had a bit of blurriness there, and that's because the oil's still in the ear. I haven't drained it, so it's almost like doing this procedure underwater. Now, water's bad for the ear, guys. Don't put any water in your ears. But olive oil is a lot more safer to use because it's acidic in nature, and the ear's also acidic. And we actually have natural oils in our ear anyway. And I suctioned some of the oil out. That's when I first went in. And now I'm just trying to manoeuvre this. Now, this plug was a bit more difficult to remove. It was a bit more impacted and lodged. And you'll see at the end, you'll see the still images. They are quite long and deceptive plugs here. And if you put too much pressure onto the skin plug on the surface, you end up pushing it further in. And the tip of this plug can then touch the eardrum. It can be a bit uncomfortable. So what I'm trying to do here is just lift this off the bottom, and I'm just trying to, you can see I've detached this from the canal wall. I can't really use any other instrumentations or ear hooks. It's too deep in the ear. I'm not going to get able to get around this plug safely without making contact with the bony part of the ear canal, so the inner 2/3 of the ear canals, the bony part. And it's very sensitive. Probably the best way I can explain how sensitive it is. And I've had my bony part of the ear canal accidentally kind of grazed with an instrument before, and it wasn't pleasant, is if you've got a tooth and the nerves are exposed and you have something cold to drink, it's a very acute, sharp pain if you get it wrong. And similarly with forceps, there's nothing for me to really grab onto. There's a bit of a tail at the bottom where I initially lifted it off the base of the ear canal, but it's just too thin, and with the forceps there, it was just going to almost cut through it. So the technique I'm using here, I'm literally just hovering over the plug. I'm not putting any pressure at all, so I don't want to push it further in. And you've got to be careful. So I'm making these little motions. Typically, when I'm removing wax, I'm making more circular, rounded motions, more exaggerated motions. With this, it's very small, minute, micro movements. And that's because I don't want to lose the suction grip. Because if I move away, so as I'm going up and down very quickly, and I'm trying to, at the same time, draw the suction probe out of the ear, if I draw the suction probe out too quickly, I'm going to lose the suction grip. Because as I said, I'm just kissing the surface. And again, I'm making these little wriggles, a bit more exaggerated ones here, but you're going to see I'm probably going to use a combination. And I'm almost, again, it's hard to describe. I hope it's making sense, but I'm almost hovering over this plug and I'm just bringing it out purely with suction here. There's hardly any grip. The suction's not actually really embedded into the wax. And it's a bit more crustier here. So all I have to put a lot of drops in, and now I'm just meandering around the ear canal, so that I'm going around the bends, and this is now the first bend. So the cartilage on the right, that's the first bend, and the cartilage just to the left, where you can see the white coating, that's the second bend. So the ear is like an S bend, and I've managed to extract that, and that's out of the ear. And you can see again that layer of skin, that's the freshly dead skin that's shedded. Nice healthy ear canal. There's the eardrum. You can just see how narrow that is. And they're the two plugs from each side. And you can see at the core, it's very dark. So that's it's not wax, that's all dead skin. And it's just kind of coated and layered itself like an onion. And again, if you compare it to the onion, the core of the onion, in terms of the skin plug, would be very dark and oxidized dead skin. And the outer layers of the onion will be the fresher layers of skin. So that's probably the best analogy I can give. I hope you enjoyed that video, guys. Take care of yourselves, and remember, be nice and be kind to each other. Thank you. Bye.